On the 30th of March 2020, the government of Zimbabwe declared a national lockdown as the COVID-19 pandemic had grounded the rest of the world. Local authorities that formed the membership of the Urban Councils Association of Zimbabwe had a mandate to be a part of the national response to manage the virus while taking care of their regular duties. It was and still is a crisis.
COVID-19 has affected the whole world. Life will never be the same again. As an association, we visited some of our members and they shared their stories.
The COVID-19 pandemic had put the struggling local authorities to the test. Social distancing and travel restrictions meant local authorities had to use smart measures to communicate and operate remotely.
COVID-19 has provided us with a number of lessons and that will prepare us for any future pandemics or problems that may befall us as communities and as local authorities. One such lesson is the importance of communication, and more so technology in communication. The issue of our social media, which came in handy. Yes, we have had problems with social media which can be misused here and there, but by and large, social media has played an important part in terms of communicating the disease, communicating the response, and making people react. So to us, we would find that we need to enhance the use of social media. It also can be used in the management of the institutions on a daily basis, and not just when there's a crisis. If there is a water-based, communication becomes much easier and faster, and the losses are reduced.
Gwanda, the capital of Matabeleland South Province, was affected by a great loss in revenue. Like other local authorities, by April of 2020, revenue collection had declined by up to 89%.
Most of our population are in the informal sector, and they have to go home and stop the business activities, which means that when it comes to payment for council bills, maybe we are getting 10% of the revenue that we were getting under normal circumstances. And we have some other unbudgeted mandates that we are supposed to fulfill. So it becomes an uphill task for the local authority. But of course, we are trying our best since we are used to delivering even when there are no resources. And we now know the art of doing it. Emfuna ukukhuthaza izakhamizi zaseGwanda njengonobhala omkhulu waseGwanda ukuthi kuqakathekile ukuthi izakhamizi zibuye zizobhadalela amanzi, lama-rates, konke indingeko okumele bazibhadale ekhansilini. Ngenxa yokuthi ikhansili ayingeke yenelise ukuthi inike iservice kungela mbadalo eyenziweyo. Siyazi ukuthi izikhathi zinzima ngalomkhuhlane wecorona esikhangelane lawo. Kodwa kuyinto eqhakathekileyo ukuthi khonoko kuncane okuthe kwatholakala izakhamizi zibhadale ukuze i-council iqhubeke isebenza njalo inika iservice engcono kubahlali beGwanda. Ngibabonga njalo abahlali beGwanda ngokubekezelela i-council ngezikhathi ezinzima la ngokuzama ukuncedisa i-council laloba nje ama-resources engenele.
Larger populations such as Chitungeza municipality had a thrust towards public health management, making the use of already existing facilities. This was made possible with the help of devolution funds in the fight against COVID-19.
In terms of some of the initiatives that have been there, that we are undertaking, what we have done is we have designated our Seke South City Council Clinic as the isolation center for all the Chitungeza COVID-19 patients. So we have been in the process of renovating and refurbishing Seke South Clinic so that it becomes a COVID-19 isolation center. So with respect to that, we've had some funding, some financial support from the central government, mainly Ministry of Health. The plan there has been to convert the facility into a 55-bed isolation center with a 5-bed ICU or intensive care unit for critical cases. So a lot of work has been done there in terms of renovating and refurbishing the premises, using funding that we've obtained from central government through Ministry of Health. Of course, we've still got quite a long way to go before the facility becomes ready to start operating as an isolation center, but we are on the way and the work is being done. In addition as well, we have plans to turn Seke South Community Hall, which is just adjacent to Seke South Clinic, into a large temporary medical facility for overflow of patients. In case we reach a point in Chitungwisa where we are overwhelmed with a large number of cases. In terms of initiatives as well, we have been working with the WHO, World Health Organization, on issues to do with contact tracing and surveillance and monitoring of our suspected cases in the community. So we are now actually have a rapid response team in place here in Chitungwisa, which can follow up and do all the testing of suspected cases and contact tracing of suspected and confirmed cases.
Residents are failing to pay their rates to council because they're in the informal sector. After we demolished the illegal structures, we've tried to formalize the way they exist. But the problem now, the economy is not performing as per expectancies. They're failing to pay and honor their obligations. That also has got a downside effect in their lifetimes. For the issues of devolution, we had received some money for devolution, but what we did now, we had prioritized the procurement of a grader. Unfortunately, the prices now of the grader is continuing to go up from 9.5 million to now it's almost 24 million, which has to be paid for that grader. So we're still negotiating with the local government ministry and the Minister of Finance so that they can top us and West Sure we buy that grader. The purpose is for us to repair, rehabilitate and maintain our road network, which is almost 210 kilometers plus or minus. And the intervention also for the COVID-19, we received $2 million from the ministry, which we did spend initially, where we're saying we prioritize each of sanitizers, face masks, advocacy, and even fuel and oils. That's what we actually prioritize for that $2 million, which we have already spent. But we're still requesting for extra money again because we had not done justice to the demand which actually was expected from us by our residents as a whole in Rua. For water supply is a mitigator measure. We've tried to drill quite a number of boreholes in Rua. But unfortunately, Rua has got a lot of granite, so which is not bankable. We have drilled for 100 meters, you see drainage dry holes, almost 4 or 5 boreholes, they're all dry.
Water situation in Rua is very critical. It's not a challenge. As you can see, that is a ready rine mvura shomanana isikwanisika kupambika kuti iende ku treatment plant. As you can see, suction pump yedu, pipe yedu intori above water levels. Challenge hombe akaiti kende kuti last season akuna kunaya mvura because nenya natural cause. So kusina kunaya mvura ndatokombogara taona chi mvura madams yedu kuti tiendese. On a normal season, to pamba mvura for 3 to 4 days a week to most of our suburbs, except maybe Zimri and parts of Dama Falls. So, as you can see, challenge iritori pokuti atitori na mvura.
In Mashonaland's Central Province, agriculture and agro-processing are some of the main economic activities. Under the lockdown restrictions, some of these sectors were allowed to operate, and the onus was on local authorities to ensure compliance.
What we did was we made sure that we had to rope in our health focal persons in the community to assist the town in educating people on the COVID-19 prevention, especially where we had hotspots, where most of the people did their tradings. And with the onset of the tobacco auction floors, there was need for people to move in with their tobacco. So when the president proclaimed that we were still on level 2, but with some sectors opened for business, we also took another stance in making sure that we complied with the president's call to actually have all those trading in undesignated places
be moved to designated places. And as we speak, Mvuri Town Council had to make sure that those people were housed elsewhere.
Public health services are some of the deliverables expected from local authorities. During the pandemic, they are a primary essential service. COVID-19 required an exaltation of existing structures.
In Chinoi, we have been affected like another local authority. In particular, our revenue streams, they were reduced, and that obviously impacted on service delivery as a local authority. At the same time, we want to acknowledge that 2 of our hospitals were actually identified as isolation centers, and in that respect, the government gave us about 3.9 million to refurbish those premises, and I'm happy to say that the work is now in progress and we are just about to complete. I'm sure we're in a position to receive any of those patients who would have been referred to our isolation centers. But generally, we've been able to mobilize our community through public awareness in terms of having to ensure that they understand what the COVID-19 is all about and how it can be prevented as a result.
The Chinese ambassador was able to harness resources from the Chinese business community to the extent that we were able to refurbish Wilkins Hospital, and we also got support from government and from our own internal resources. We were also able to refurbish the Beatrice Infectious Hospital. As I'm talking to you, revenue, which was expected to be 60 million per month, plummeted to roughly around 5 million. And we can't get revenue, the industry is closed, the informal and formalized sectors are closed. They have to meet certain requirements for them to open up. So these were challenges that came our way, and for 3 months, 4 months, we are in a difficult situation.
The finances went down by almost a third. So, but however, we got funding from government. We managed to rehabilitate one of the isolation centers. We got 2 million injection. We managed to utilize all, and as council, we also managed to do our sewer reticulation. We managed to upgrade it. We removed the old blocked pipes and we put in new ones up to about 2 kilometers. We are targeting 3.6 kilometers for that, and there's quite some relief from sewer bursts in Chegutu. We are very happy, and as we speak, the revenue is beginning to improve because of improved service. We have also pushed in water where there was no water. Of course, we got funding from government through the devolution funds, and there are areas where people had not received water for 7 years, and they've just received it now.
We would like to encourage our residents to keep paying their bills so that we keep offering the excellent service that we've been offering to them over the years. As Redcliffe Municipality, we face the same challenges that everyone has, but we've tried to survive and think outside the box. We got a bit of support from central government in terms of devolution, which we've used to rehabilitate some of our clinics. We've also been rehabilitating market stalls, and we've tried to continue with the projects that we had previously before the pandemic. Of note though is that our revenues are low, so we are mainly relying on support either from central government and from well-wishers. We've had GIZ come in. They are also going to be assisting us in terms of rehabilitation of our clinics. So in terms of COVID, that's where we are. We're trying to make do with what's available.
Despite the massive disparity between service delivery expectations and unmatched revenue, some local authorities have managed to revamp roads and rehabilitate water delivery services.
Right now, we are resurfacing our roads at the industry there. They were a menace to our motorists. But now, since it's now 2 weeks, we are resurfacing them. We are also, if we go at our water treatment plant there, we are refurbishing the whole system. We were assisted by the Ministry of Health. They gave us 1 million bond, and they said, please, this money, you must use this money in making sure that the water treatment plant is refurbished, in making sure that the sewage system is refurbished. So honestly, right now our water, yes, we have a shortage of water, yes, but it's not as it was before.